9-day-old boy with very small heart. This is ascending aorta. This is pulmonary trunk. Both are of similar size, and this is arterial brachiocephalic trunk and left common carotid and left subclavian artery in usual manner. This is right atrium. This is right ventricle. We open the right ventricle like this to see the arterial trunk rising from the right ventricle. This is ventricular septum, tricuspid valve. Here is the arterial septum between anterior pulmonary trunk and posterior aortic valve, aortic trunk. So the V-shaped margin is formed below the arterial septum, which do not meet neither with either of them. So the posterior limb of the TSM joins with the ventricular infundibulum fold, and then the partly close to outer septum. And anterior limb also go to anterior wall of pulmonary artery and doesn't meet to the outer septum. So from here we can see both. So if you look at the outflow from the left ventricle, we can see mitral valve here, and also we can see outer septum viewed from left ventricle, so that this is pulmonary outflow, this is aortic outflow. In between there is an outer septum here. So the outer septum on the left side goes to anterior part of the aorta, so that it is like this. So the it may cause the subaortic and subpulmonary stenosis of the outflow tract of left ventricle. This is subpulmonary, this is subaortic. So this is a kind of double outlet left ventricle and double outlet right ventricle with complete malalignment of outer septum to the trabecular septum. And we may think that how this heart will be in the future, that by the hypertrophy of the myocardium and development of arterial trunk, the shape of this will be become a little different, but left ventricular outflow will grow, and subpulmonary infundibulum may smaller by future, or indeed the other way around. Six-month-old girl. Six-month-old boy with situs inversus. Left lung is 3-lobed and right lung is 2-lobed. So left atrium is right atrium is on the left side with usual way. The SVC is here. Right atrium is here, and right there is a right atrium, IVC, and there is a mitral tricuspid valve inflow to the right ventricle like this, and which is in superior of ventricular septum. So atrial inflow from the left side right atrium is this way as a superior inflow, and then the left sided mitral valve, left atrium goes to inferior ventricle, so that here is the mitral valve with in this direction. So main part of left ventricle is on the left side, so in this direction, so crisscross heart is formed at this inflow level. And then if you look this as an outflow level, it is like this. It was like this, but we can think like this, so that the left ventricular inflow goes to outflow here, and tricuspid inflow goes to the outflow there. So anterior great artery is a pulmonary trunk, and posterior great arteries or the aorta, which was both from the superior ventricle. And there is a overflow to pulmonary trunk, so pulmonary artery banding was placed to decrease the pulmonary outflow. And then now the aortic outflow has to be in unobstructed way, so that inferior ventricle is used to support left aorta, so that intracardiac baffle was placed through the VSD to aorta, and then pulmonary artery was tried to make a Rastelli conduit from the superior right ventricle here. But it was very complicated and unsuccessful for surgery. So this is superior ventricle with tricuspid valve inflow from here there to there, and then it goes to anterior pulmonary left-sided and anterior pulmonary trunk, and the posterior great vessel was aorta, which is in double bilateral corners but closer to the atrioventricular valve. So posterior great vessel is aorta, ascending aorta, like this. So the shape is very unusual, but it is very much expected way that mitral inflow, tricuspid is on the left side inflow here, mitral valve is on the right side inflow here, and right ventricle goes to pulmonary artery here, and left ventricle goes to aorta as a posterior great artery.